Hello, everyone. Welcome to, I want to say this week, but I can't actually say that because I've had a bit of an unintended long break from the podcast due to a number of reasons. But I feel like I'm back with a bang today for this episode. So today on Postnatal Minds, we're diving deep into a topic that impacts millions of parents, but it still doesn't get the space that it deserves. Recovery after cesarean or C-section birth. And whether your C-section was planned or unplanned or even traumatic, this episode is definitely for you. And my lovely guest today is Emma, the co-founder of the 360 Mama. And Emma is a women's health specialist physio and also the co-author of her brand new book with Hannah West, which I might let you kind of show and talk about. But ultimately, it's their guide to C-section recovery, everything you need to know, which is so needed. And I wish that I had had access to this book before my 2 C-sections. So welcome, Emma.
Hi, Rosie. Thank you for having me.
Oh, thanks for coming on. And I know you've been really busy with the book launch. It's probably important for me to say, actually, so that I stumbled across you guys after my first C-section. I was really struggling with my scar, and I'd heard about Hannah and I had C-section scar massage, and I was like, wow, I can't believe this isn't part of at least what we're given after hospital, let alone maybe even part of the care postpartum for C-section. But yeah, do you want to tell us a little bit about what it is that you guys do, maybe how 360 Mamas happened and what you aspire to?
Yeah, absolutely. Hannah and I, we both work and live in Brighton and Hove area. And actually, as you know, Rosie, in our area, we are super lucky in that we do have a really strong women's health community. And so through that, there's quite a lot of networking between professionals, and often clients that we see, we will refer between that network, because truly sort of for women's health, certainly in postpartum health, it's often a kind of holistic care force that is required. So Hannah and I met through that network, and we are really aligned with our values, and we often would sort of see clients alongside one another. And then it was actually around, the pandemic and COVID, when women were even more so than is normal, struggling to find access to postpartum care. And it was just becoming really clear sort of to us through our own client group, but also sort of online. But I was also pregnant at this time as well. So it was my own experience that it was just impossible to find the support, the information, the right kind of professional guidance. So we launched the 360 Mama as an online program. And that was our goal, really, to make it more accessible for families and for women as they kind of navigated pregnancy and postpartum with a team of experts and professionals, because, there is lots of conversation online, but it's not always expert led. And we just kind of wanted to feel like it was that sort of professional guidance that people were looking for. Along the way, we've worked with a nutritionist. We, certainly in the book, we have other guest contributors who are all experts in their field of kind of holistic or postpartum health. And it's really about, that's where the name came from, 360, is that it's this sort of whole care embodiment. And as you described, that's physical and emotional coming together, and understanding that particularly around C-section birth, those two things are super important to address together. And so we now have, I think it's kind of testament to the fact that people are really looking for this information. We have a big social media following, which suggests people are looking for it. And through that, we ended up getting a book deal, which at the even now, I can't believe that that's true. And that book got released today.
Amazing.
So that's super exciting. Yeah.
So I remember when I first went to Hannah, now this must have been 2021 when you just started. So that's how long it shows you that process has taken. But, and actually I always say this about when I went to Reformer Pilates as well, post-birth. I remember when I went to Hannah, it was the first time I'd looked at my scar. I totally disconnected from my scar. I don't know why. I guess it's such a huge thing to go through for your body, emotionally too, when you've carried a child for that long. But I remember being right, I've sorted, but I'm on track with sorting my scar and my physical. But actually, I also hadn't visited what was going on in my head at all. And I was, I remember that being a helpful way for me to physically look. But then that fed into kind of why postnatal mind came up. And I think I remember having a conversation with Hannah saying, I'm thinking about doing this, but I'm not sure. And I remember her being like, yes, 100%. You need to do it. And you're so lucky around like it all comes back around. Like I'm now sending people to you and Hannah, and yeah, that community is tight here, so we are really lucky. So before the book, and I know you've got a physical clinic that you work from where you deliver kind of C-section massages and consultations and massages generally as well. What because it was mostly online, wasn't it, the resource that you had before that you created for women?
Yeah, which we still have. And at this point, we kind of have thousands of women within that community, which is amazing. The online program is because there are many reasons why people can't access in-person care even now. And so, you know, that comes down to that you live in a more rural area, and those options just are not there. It might be that you cannot leave the house because, you know, of issues with you or baby or your feeding. You know, financially, people can't always manage to go and see multiple professionals. And also just sometimes, you know, people aren't ready or they're not in that space. And, you know, as you've said, if you're struggling with sort of how you feel about your scar, you're not really wanting to engage with it, you maybe don't want someone else to do that either. So yeah, we still have an online course, and it brings together, you know, my expertise as a physiotherapist. So I specialize particularly in pelvic health. So within that, we do lots of stuff around your pelvic floor recovery, lots of kind of just simple education about the simple things you can do to really enhance that, managing prolapse or understanding or recognizing symptoms of prolapse if that's a condition that you're struggling with, things like the diastasis, so the separation of abdominal muscles, and just a general sort of safe return to movement and exercise. And then we combine that with nutrition, and not sort of diet plans in the sense that we're looking to sort of push losing weight, but just understanding that what you put into your body are essentially the building blocks for what your body then uses to create scar tissue or to help heal your connective tissue and build your muscle strength back up. So about understanding that what you put in can really make a difference to your energy levels as well.
Yeah.
Using yoga and Pilates to help you manage stress, to help you ease aches and pains. And then, of course, Hannah, who is our scar therapist, taking you through like a complete program of scar massage. And just to sort of touch on that the real important thing about that is that it should be a progressive program. So I think more and more people are understanding now that scar massage is something they should be aware of, but it is quite a lot more than just rubbing a cream into your scar.
Yeah.
And actually starting something like that too aggressively too early on could be detrimental, or certainly could put people off because it's not comfortable. So we kind of take you through a program where it's like, here's where you start, here's where you build up, here's how you add additional techniques. This technique is great for this type of scar, or if you have this type of scar, stay away from this technique. So it's just a little bit more in depth, I think, and hopefully that's the goal, is that you feel like you kind of got professionals in your back pocket that are just there to take you through every step.
Yeah. And something that I remember learning when I went to you guys around my scar management was the importance of breath and breathing in that period as well. And I think it's those little things that we don't really think about, like the diaphragm muscles and all the connective, like you said, pelvic floor, that's a whole other area. I did an episode with the mummy physio, and you know, that's a whole other area that's not talked about and educated about enough. But yeah, just the importance of taking big deep breaths and like re-engaging your physical. I think that kind of gets put on the back foot, you know, in that postpartum fourth trimester. You don't feel like you are relaxed taking big deep breaths. So if there's people watching that are going to have a C-section that haven't had one before, what is it that they will be offered on the NHS, and what is it that you think they should, if you could redesign the NHS pathway for C-sections without the broken system, what would you say is like the A-class route?
Do you know what? I think some of it is a bit dependent on, like, if you know that you're having a C-section and you have the time to prepare for that, and it's something that you go into it kind of knowing about, often your recovery experience is quite different than somebody that experiences an emergency C-section. So I think probably the first thing that I would change is helping women to be prepared better for the outcome of a C-section, even if it's not what they're hoping for or planning, because the stats show us, you know, it's now about 1 in 3 women in the UK. I think those stats are higher in other places, and they're consistently growing. So the reality is that for a lot of women that hope for a vaginal delivery, the outcome is a C-section. You know, very clearly, when that is in a situation where they feel very out of control, it's very against their initial birth plan, and therefore there's a lot of emotion tied into it, the recovery really, really struggles. So I think it would start from earlier than the actual C-section itself, and it would be about better education from the beginning. And then I think it would be about putting certain things in place for your recovery. And actually what we try to kind of support, explain in the 360 Mama is that it's often really simple stuff. Like, it's not a massive complicated plan. It's like, plan for 2 weeks of rest postpartum, and like take that seriously. And you know, for so many people that's really difficult to do because they can't get their heads around it, or there's lots of outside pressure. But in actual fact, if you can take the time to, you know, get home, rest, and move around the house a little and often, just to do simple little, you know, tasks like go to the toilet or make a cup of tea, but the rest of the time you spend that time resting, that will make a massive difference to the speed of your recovery and also reducing problems that might crop up later down the line. And then I think alongside that is just understanding like good wound care. So being able to recognize like, what are the signs of infection? When should you go for help? What are the products that can make a real difference to your scar, and being able to apply them sort of earlier on in the process really makes a difference to the quality of your scar tissue. So I think it would just be about, you know, better preparation and then proper education afterwards. It doesn't even need to be that you have professional input necessarily, because if you're following all of those things, for a lot of people the outcome would be better anyway.
Yeah, sure. It feels like there's a lot of avoidance from women to look at all birth options as an option. There's a lot of negativity around having a C-section still. And it's interesting because there used to be the whole like too posh to push and all of like the easy way out. And I mean, don't get me wrong, I don't think any way is the easy way out. I don't think there's any nice way of doing it. You know, I think it's changed. We're getting there and the education is getting there, but it's a shame that we don't approach birth in the... We have a birth plan, which I think should just be birth preference. And I think we should view it like that, knowing that there is a very equal stat that you could end up with a C-section, a planned C-section, a vaginal birth, forceps intervention, you know, that induction. Like, I think we just... It's like going into an exam without having out revising. Like, we just need, and I think that's why I bet your book will be really Amazon ordered for people that didn't intend to have a C-section and think, wow, because I mean, both of mine, I prepared as much as I could for, and they were elective, but I still really struggled. They're hard, like it's painful and it's hard, and you don't realize how much you use your core for. It's a bit like how I feel about mental health after birth and emotional debriefing. We don't talk about the 4th trimester, and actually it might be one of the most lonely, difficult times of your life, as well as feeling like love and this amazing thing that's now entered that you've got to keep alive. But it just feels like there's still so much work for us to do in raising that awareness. And that's why I think, well, one of the reasons I think that what you do in your book will just be so helpful to people.
Yeah, I really hope so. And, you know, that's the whole reason that the page is still going. But, you know, like you said, we do continue to work in clinic, and, you know, to keep up with that level of social media isn't easy. We, you know, every day we just have so many messages from people about how much it's helped, and how it's helped signpost them to finding the professional that supported them. And, you know, obviously for us that's like the greatest motivation behind it. But I think, rewarding. You know, as you said, the sort of trend, I definitely used to almost probably more likely to be able to see like a mum the second time round, because I think the first experience is so different and overwhelming, and you're unprepared for it, that you are fairly unaware often. And it was often that I was seeing people sort of in the second time where they were like, wow, well, I remembered how I felt after the first one. Then I educated myself. And now, second time round, I'm doing it completely differently. And what's
Yeah.
so positive now, both Hannah and I have discussed this, is that we are seeing so many more first time mums. And even to the point where people get in touch when they're pregnant and they're like, what week should I book in with you? When should I book that
That's
mummy
so
MOT?
good.
And I just think, you know, that is absolutely because stuff like this is just out there, and, you know, people are
Yeah.
taking the time to educate themselves in pregnancy. And, you know, ultimately knowledge is power, right? So it's
Yeah,
great.
100%. And I remember when I had my second C-section, I I was in hospital for like 3 nights, but I remember my pain. I remember being like, oh, hello, pain. I remember this pain, but it was so much worse. I think they must have like cut into scar tissue or something, but I remember thinking, I cannot go home whilst it's like this. And I think I ended up having, oh God, I can't remember the medication, but I definitely had something rectally and it made me feel so much better. So I think quite a lot of wind had got trapped as they were like sewing me up. I can't remember.
Yeah, do you know what? It's funny, but that's honestly like one of our like most watched videos is about the fact that you can get such crippling pain around trapped gas post C-section. And so for a lot of people it's like this like flash, like intense awful pain around their shoulder. And we've had, you know, so many views on it, but also so many women then follow up with messages being like, oh my God, that pain was like worse than labor, it was worse than birth, like I just did not know what it was. And, you know, ultimately, again, it's something that's quite simple, and there's certain things that you can do that really relieve it.
And sometimes there's not things you can do. Like I took in chewing gum, green tea. I did all the things that I knew from last time because I was really clogged up the first time and that was sore. But the second time I had to just say to the doctor, I know I'm in too much pain. And I had PR meds and they did really release it. It's so unglamorous.
The key being there that you could advocate for yourself and say like, this is too much and can I have help? But you know, one of the really frustrating things is that people are too often told, oh, it's normal, and then that's the end of it, and they're not really given the help that they need when, you know, pain like that is just never normal. Yeah, 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 yeah. Yep. I mean, definitely, as you said, the concept that it's like easier in any way, the kind of big part of that being that people maybe assume or think that their pelvic floor is going to be better post C-section, or that it doesn't require pelvic floor rehab post C-section. But actually, the pelvic floor muscles have still gone through a great amount of strain just by helping you to manage the additional weight and pressure of pregnancy. For many women, they've gone through phases of labour before they've got to an emergency C-section. So absolutely, if you've had a C-section birth, you still need to do the pelvic floor rehab. And I'd really advise that you do see a pelvic health physio for an assessment, because what I do see an awful lot of in clinic is that women, particularly post emergency C-section, have a lot of sort of like guarding of their pelvic floor muscles that is a response to sort of whether it's trauma, whether it's feeling out of control, or just, you know, a protective response. And that can cause a lot of pain, like pelvic pain generally, pain during sex, issues with bladder and bowel function. But again, a muscle that is kind of stuck in tension is not functional. So you don't necessarily need to be doing loads of squeezes and tightening. You need to be doing range of movement exercises. So that's probably a big one. You know, I think there's lots of misinformation out there, but ultimately that your C-section overhang or your shelf is because of having put on weight during pregnancy and that you haven't lost the baby weight. But actually what we know is that even if you had like zero body fat, if you've got a scar that's pinned in and it's pulled in because of adhesions through the layers of scars, then actually that is what's creating the shelf, and anything above it therefore comes over the top of that shelf. And so you can still be really unhappy with the appearance of it, despite all of the effort that you may or may not put in to lose the weight. So that's probably another big one. Hmm. Yeah. 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 Yeah, it sounds like it. Yeah, and that's a good question that we get a lot. Like, is it ever too late? The answer is no. Like, scar massage can be really effective. Years later, both Hannah and I, and other colleagues and professionals that we know, have amazing results with scars that are really much, much older. The kind of phases of the scar that you want to be aware of, like the first 6 months, there's a lot of change going on. There's a lot of like remodeling. So that often is a phase in which the scar will naturally change a lot anyway. So any additional treatment that you're kind of giving it or putting in really helps to support that change a little bit more quickly. But your scar doesn't fully mature until about 2 years. So that first 2 year phase, even if you've done loads of work, say in the first 6 months, and then, naturally things drop off and life takes over, it may well be that actually that scar is still going through quite a lot of change, which means that that early work, you kind of needed to just extend it or pick it back up again. And that's true even of scars, beyond that point as well. So it's probably about kind of understanding what technique you need to be doing at this point. And one thing that you mentioned is that you kind of put your oil on and then you're rubbing around on it. But often actually doing some massage work first on dry skin, where you can get a bit of friction, which means that actually you can get more movement and grip between some of those layers, works a little bit better on that like thicker, firmer scar tissue. Because if you've got a layer of oil on the top, you're just sort of slipping over the top. Yeah, and that's sort of beneficial for other issues like, nerve sensitivity and stuff like that. But actually, maybe what you need with that thicker stuff is just to get into it a little bit more. So there'll be certain techniques, but I'd also try a bit of, doing it on dry skin and then maybe apply your product afterwards. Mm. Yeah, yeah, totally. Yeah, and it's why, postpartum recovery is rarely linear for that reason. And like as therapists, whatever sort of field that you're working in, I just think that's what kind of is the difference between having a successful therapeutic relationship with someone and not, because it's about, understanding where they're at and meeting them at that point. And if that means that, like you've said, you have a bit of a break because you've got other stuff going on, that's fine. And that's just the reality of being a mum often. And yeah, think I'd really love it if people had that message of like, it is never too late. And whether that's your pelvic floor function, whether it's your diastasis, if it's just that you're trying to get back to exercise or fitness, or it's your scar, like there's always a point in which you can return to it and have results. Yeah, I think the sort of 6 week thing, there's so much rolled into that, isn't there? It's often like maybe when your GP appointment might be, it might be when people have talked to you about going back to exercise. It's kind of like this golden figure. And ultimately it's, yeah, drive-in after a C-section, exactly. But I don't think people ever kind of really fully look into why that is. But ultimately, the first 6 weeks is when your body goes through its initial early acute, and I like really like it is just the acute healing, which means that it might be ready just about to move on to doing something a little bit different. But that is again dependent on like, have you taken that time to rest? Have you given your body good nutrition during that time? Did you have a particularly horrific birth? In which case, any of those things might mean that that time frame is way longer. So I totally agree with kind of managing the individual. But often that is why your GP kind of plans it around that time, because your body will be going through change quite rapidly throughout that time. So to see somebody, at 2 weeks, it would anyway be really different at 4 weeks. So we kind of want to allow the body to do its early stages. From kind of postpartum physio, which is often where I come in, I tend to sort of say to people post vaginal delivery from around 6 weeks, post C-section delivery usually a little bit longer, around 8 weeks. And that's purely because something like C-section scar massage isn't really appropriate until around that phase. So otherwise we're kind of doing an assessment and we're missing this chunk of potential advice and treatment. So if you are thinking of doing C-section scar massage, you do need to allow your body that time beforehand to actually heal properly. And again, that is dependent then on, has your scar properly healed? Have you had an infection in that time? Have you still got scabs over that area? In which case you need to wait longer because it's not ready for that. And then the introduction of, exercise. Yeah, exercise at 6 weeks, realistically, we're talking about like gentle movement that helps the body to heal. We are not talking about running back to your like, HIIT class or the gym class, the gym class you did when you were not pregnant and super fit, or running a marathon. Exactly. And I saw a really interesting stat fairly recently, which said that actually, even sort of at like 4 or 5 months, your pelvic floor is still only recovered by about 40%. So it's still, in its natural timeline of recovery, it's still got a long way to go. And, with physio input or exercise input, you're helping that process along, but it hasn't recovered 100% for quite a lot longer. So you need to be realistic about a progressive return to exercise where you're working at a level that is tolerated by all of the tissues, and that builds up slowly. It just can never be this sudden leap back. It's just not a good idea. Mhm. Yeah, it's a great question. And like, I think this comes in as part of that preparation thing. If you can let, people that you're at home with know that your plan is to rest as much as possible, what can you put in place to make that happen? Could it be that they are able to take paternity leave that allows them to support you during that time? Do they have the possibility of extending that any further? If you know that you don't have that support from your partner, do you have somebody else who can take their place? If it's sort of second, third, fourth time round and you've got other children, definitely can you put things in place that means that they are supported and looked after? Because going on the school run 2 days after a C-section is not going to do anyone any favors. Um, yeah, 100%, 100%. We sort of always find it fascinating whenever we put something out online about like leave the chores. Like you don't have to hoover your house in the first few days postpartum. And the conversation is so divided, and I do understand it. I sort of laugh now, but I do understand that there's a real problem behind this, where some people do not have any support at all, or they have certain expectations of themselves that goes beyond someone just saying like, "I'll just leave it." But honestly, those things have to go down your priority list at first, because you're taking pain medication for a lot of this, and it's quite normal that people are like, yeah, actually I feel fine a couple of days after or a week after, so why not push the hoover around a 2-story house? But it's the after effects of that, and maybe not even immediately, but like your scar is still knitting back together. You've got lots of internal wounds. Like I said about the pelvic floor, it's doing so much work to recover. Adding something like that to the equation is just a no-go. So if you've got a partner that can do that and you feel that it's really important to you, hand that over, delegate it. And the other thing that I always say is just like friends, family, if they want to visit or come over, either put boundaries in and say that's going to be a little bit later because I'm just using this time to recover, or for those that are around, or even later on, like come with something useful. Like the obvious ones is like nutritious, like healthy meals. Yeah, because of course, like, yeah, you don't have time or you don't want to cook yourself these big, elaborate, healthy meals. But like I said, what you put into your body changes the game. So relying on takeaways and stuff like that, it's not really helping. So those would be my tips for a partner. Yeah. 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 Yeah, exactly. Hmm. Yeah. 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 Yeah, I mean, as you said, breathing is like my absolute top tip. It's such a simple thing. You can do it from day one. And by doing like deep diaphragmatic breathing, you're helping your rib cage position realign. You're helping to manage intra-abdominal pressure, which means that actually that helps to support your diastasis recovery, or even if you've not got significant diastasis, just help your core recovery. Your diaphragm and your pelvic floor should be aligned and they should mimic one another as we move. So by doing deep breathing, you're actually kind of getting pelvic floor recovery going as well. So I would begin there by all means. And then I think kind of early rehab, it would be about like trying to engage with your scar. So although you can't do scar massage, you can lay your hands over your clothes and allow yourself to touch that area. You could do some gentle massage sort of higher up the abdomen, which helps just sort of desensitize the area, helps encourage you sort of accepting your body, accepting the wound that is there. That helps so much with the emotional recovery, but it also helps just sort of flush some of that fluid away, and other positive things as well. And then alongside that, I think it is just about sort of just gently returning to movement. And even if exercise isn't something that you've typically done because you're really into sport and exercise, just moving generally, like, it's so good for your mental health. It really helps your body to kind of ease some of those typical aches and pains, and it's quite an empowering thing as well to sort of move your body in a way that feels good and safe to do. So whether it's following our program or whether it's that you get the support from another professional, I'd say that is something not to overlook. Yeah, yeah. Yeah, absolutely. And I would almost say that if you're treating postpartum women, particularly C-section women, and you're not addressing that, you're missing a huge piece of the puzzle. Within the book, we've got a guest contributor who's a birth trauma therapist, because it's such a huge part of C-section recovery. And I just don't think you can separate the two. And that's true, for some people, even if, like you said, the experience itself was good and, a positive experience, there's still other emotional things to untie. And so for me, I think Hannah and I probably slightly differently. Hannah, often when she's like interacting with the scar and the tummy area, she'll notice that there's a big emotional release with a client. For me, maybe slightly more unexpectedly, but people are maybe coming in for that mummy MOT when we're doing sort of a pelvic floor assessment, and perhaps they've only really expected to come in and get told how to do their pelvic floor exercises and, like, yeah, you're safe to start exercising. But actually in that pelvic floor assessment, it is often a huge emotional release, to the point where I'll often warn clients before it. But I get a little bit of a clue along the way if somebody's described their birth to me and it's clearly been very traumatic. But as I've said, because we have this physical response in the body to trauma, and that creates changes physically and symptoms physically that I identify, but they may not have put the two things together. And then as soon as we kind of unpack that, or we recognize, or we're just treating an area where there's been so much of that tension or trauma held, it's a huge emotional release. And if I'm trying to treat pelvic pain, or very common one is pain during sex, for example, post-birth, and I'm trying to treat that, then actually we have to address the psychological kind of side of it, which is, again, why I often work with other professionals, because we see clients at the same time and we combine our expertise to get to the end goal. Mm, yeah. Yeah. Yeah, so this is it. Yeah. And actually, yeah, I mean, Hannah will be really pleased by that because her husband actually designed the front cover of the book as well. So yeah, feels a bit more personal. But I think, yeah, exactly. But we think, and why we created it, is that it takes you from literally A to B the whole way through. So we've included preparation in there. So we really, like I've said at the start, we really want people to start to get on board a little bit more with recognizing, address it before it actually happens, because it makes your whole recovery so much easier. So we've got lots of stuff about how to prepare for one, what to expect on the day, what to expect in the surgery itself, how you can advocate for yourself, how to make certain choices based on kind of knowledge and education, so it doesn't feel like it's so scary in the moment. And then we go on to sort of this step-by-step guide. So we've got recipes in there, we've got nutritional guides, we've got, as I said, support from like a hypnobirthing instructor to help you in that environment rather than it only being applicable to vaginal birth. We've got some birth trauma counsellors, we've got midwives, we've got wound care nurses, and then obviously Hannah and I's expertise around all of the physiotherapy. So your breath work, your pelvic floor, your core recovery, your exercise. It's complete with videos as well. So there's QR codes in here that you can use, which takes you immediately to video content. So you can follow some workouts with us or some video content about massage. And then Hannah's done this really brilliant kind of step-by-step guide about all the versions of scar massage, when to use it, which scars you need to use what on. And we've included lots of advice about our favorite products and stuff like that. So hopefully at the end of it, there are no questions left. We have answered them all in here. Yeah, absolutely. So we are just at the 360 Mama across all of our socials, and we do a lot. So we've got Instagram, TikTok, YouTube, Facebook, and so anything like that. And then our website is www.the360mama.com, and you should be able to find everything that you need in there. Thank you. Thank you. Yeah, thanks, Rosie. And honestly, thank you for like supporting it and helping us to kind of promote it. Thank you.